What are the risks of anesthesia for plastic surgery? When considering plastic surgery, many patients wonder about the risks associated with anesthesia. While anesthesia is generally safe, it does come with certain risks that are important to understand. These risks can arise from both the effects of anesthesia on the body and the specific nature of the surgical procedures involved. First, let's talk about the general risks of anesthesia. Serious complications from general anesthesia are quite rare, occurring in about 0.1% to 0.16% of cases. However, certain factors can increase these risks. For instance, obesity, smoking, chemical dependency, and poor overall health can all heighten the likelihood of complications. It is crucial for patients to disclose any health issues and medications to their surgeon to help minimize these risks. The moments when complications are most likely to occur are during intubation, which is the insertion of the breathing tube, and extubation, the removal of that tube. Now, let's look at some specific anesthesia risks related to plastic surgery. One significant concern is the risk of deep venous thrombosis and pulmonary embolism. These conditions involve blood clots that can form during or after surgery. Procedures like liposuction and abdominoplasty have a higher risk for these complications, especially when they are combined or prolonged. In fact, studies suggest that pulmonary embolism is a leading cause of mortality following liposuction, accounting for around 23% of deaths in some cases. Another risk to consider is fat embolism syndrome. This can occur during liposuction when fat particles enter the bloodstream, potentially leading to serious complications. The risk of this syndrome increases with the volume of fat removed and when multiple procedures are performed at once. The duration of the surgery also plays a role in anesthesia risks. Surgeries that last longer than 4 hours can lead to increased complications related to anesthesia. Longer procedures can elevate the risk of blood clots, respiratory issues, and other morbidities. Bleeding and hemorrhage are additional concerns. While preventive blood thinners can reduce clotting risks, there is still some worry about increased bleeding during surgery. However, when used correctly, these blood thinners do not significantly heighten the risk of bleeding. Several patient and procedure factors can influence these risks. For example, being over the age of 40, having obesity, being immobilized, having malignancies or conditions that increase blood clotting can all raise anesthesia risks for plastic surgery patients. Additionally, combining multiple procedures can increase the complexity and duration of anesthesia, further raising the chance of complications. To ensure safety, experienced plastic surgeons and anesthesiologists carefully assess individual risk factors before proceeding with surgery. They may use mechanical prophylaxis, such as compression stockings and venous pumps, to prevent blood clots. In high-risk patients, low molecular weight heparins may be given to prevent thromboembolic events without significantly increasing bleeding risk. General anesthesia is often preferred for complex or lengthy plastic surgery procedures because it provides airway protection and maintains a consistent level of anesthesia. In summary, while serious complications from anesthesia in plastic surgery are uncommon, it is essential to be aware of risks such as blood clots, fat embolism, bleeding, and airway complications. Understanding these risks, along with proper preoperative evaluation and adherence to safety protocols, can help minimize potential issues in the surgical setting. Always consult with healthcare professionals for personalized advice and to ensure the best outcomes for your specific situation.